Hi, I am Dr. Sarah Collins. Before you scroll, before you look away, I want you to pause for just one moment and ask yourself something very serious. Are you truly prepared for what your body can suddenly do after the age of 40? Or do you believe that paralysis, confusion, or sudden loss of speech only happens to other people? Because if you are over 40, 50, or 60, what I am about to tell you in the next 1 minute could determine whether you live independently or spend the rest of your life dependent on others. In this video, you will learn exactly why sudden paralysis does not always mean stroke, why thousands of seniors are misdiagnosed every year, and how knowing this difference can save your life or the life of someone you love. Most people have been taught one simple rule. If a face droops, an arm becomes weak, or speech suddenly stops, it is a stroke. Call 911 immediately. That message is correct, and it has saved millions of lives. But here is the part no one talks about, and this silence is dangerous. New research shows that a large number of adults over 60 who arrive at the emergency room with sudden paralysis are not having a stroke at all. Their brain is not being attacked by a clot or a bleed. Instead, their body is being overwhelmed by a severe infection, a condition called sepsis, and it can imitate stroke so perfectly that even experienced emergency doctors are fooled. Imagine this scenario. An older adult suddenly cannot move one side of their body. Their face droops. Their words become slurred or disappear completely. Family members panic. The ambulance arrives. Stroke protocol is activated. Everything moves fast but in the wrong direction. The brain scan looks normal. Meanwhile, the real enemy, a hidden infection in the lungs, urinary system, or abdomen, is spreading through the bloodstream. Every minute that passes without antibiotics increases the risk of death. By the time sepsis is recognized, hours may have passed, blood pressure has collapsed, organs are failing, and survival chances have dropped dramatically. Now imagine the opposite. A real stroke is happening, but the patient also has a fever or abnormal blood tests. Doctors suspect infection first. Stroke treatment is delayed. The narrow window to reverse brain damage closes. The result is permanent disability that could have been prevented. This is not rare. This is happening every single day, especially in adults over 40, 50, and 60. The most frightening truth is this. Sepsis and stroke can look identical at the beginning. Both can cause sudden paralysis. Both can cause facial drooping. Both can take away speech. Both can cause confusion or loss of consciousness. That is why awareness alone is not enough anymore. Seniors and caregivers must understand the subtle clues that separate these two emergencies because the treatments are completely different, and time matters in both. In this video, you are going to learn 6 paralysis-related symptoms that confuse stroke and sepsis more than anything else. You will learn how they feel, how they begin, how they progress, and what tiny details can point toward the correct diagnosis. These details are often missed in the chaos of an emergency, but you can notice them at home, in a restaurant, or while waiting for help to arrive. That knowledge gives doctors a head start, and that head start can mean the difference between recovery and tragedy. Let me be very clear. This is not about ignoring stroke warnings. This is about understanding that paralysis has more than one deadly cause in older adults. Sepsis is not just an infection. It is a full-body inflammatory storm that can shut down the brain just as effectively as a blocked artery. In seniors, the immune system responds differently. Fever may be mild or absent. Pain may be subtle. Weakness may be the first and only warning. Statistics reveal how serious this problem is. Studies show that nearly 1 out of every 5 seniors who arrive at the emergency department with sudden neurological symptoms, believed to be stroke, are actually suffering from sepsis. At the same time, many true strokes are initially mislabeled as infection. The cost of these mistakes is measured in lives lost and independence stolen. What makes this even more dangerous is speed. For sepsis, every hour without antibiotics raises the risk of death significantly. For stroke, every minute without restored blood flow kills brain cells. That means hesitation, confusion, or assumptions can be fatal. This is why you must stay with me until the end of this video. Each symptom we discuss builds on the last, and together they create a clear picture that most people never see until it is too late. If you are over 40, this video is about your next decade. If you are over 50, it is about your independence. If you are over 60, it is about survival. In the next part, we will start breaking down the first paralysis symptom that silently confuses sepsis and stroke, one that many people ignore until they are already on the floor, unable to stand. Stay with me. This information is not optional. It is essential. Now let us move deeper, because this is where most families get confused and where the danger quietly increases. The next symptoms look so obvious, so textbook, that people stop thinking and assume the diagnosis is already decided. And that assumption is exactly what costs time. One of the most alarming moments for any family is when an older adult suddenly cannot use one arm. They try to lift it, and it falls. They reach for a cup, and their fingers will not close. This has been drilled into public awareness for years as a clear sign of stroke. And yes, it often is. A stroke affecting the motor areas of the brain can instantly shut down strength on one side of the body. The arm feels heavy, useless, foreign. It happens suddenly, sometimes mid-movement. But here is what almost no one realizes. Severe infection can do the same thing. In adults over 40, especially those with diabetes, kidney disease, or weakened immunity, infection releases inflammatory chemicals that directly interfere with brain signaling. Blood pressure may fall just enough to reduce blood flow to sensitive areas of the brain, particularly where arm movement is controlled. The result looks identical. The arm will not lift. Grip strength disappears. Coordination is gone. The key difference is often not how it looks, but how it behaves over time. Stroke-related arm weakness tends to stay the same or worsen steadily. Sepsis-related weakness can fluctuate. A person may be very weak one moment, then slightly stronger after fluids, rest, or stimulation, only to weaken again as infection progresses. This fluctuation is subtle, but it matters. Another critical symptom that traps people is facial drooping. When one side of the face sags, the mouth pulls unevenly, and smiling becomes impossible, everyone thinks the same thing. Stroke. Emergency. And again, they are right to act fast. But facial weakness is not exclusive to stroke in older adults. In severe infection, the brain becomes inflamed and poorly perfused. Facial motor control can weaken, sometimes gradually, sometimes suddenly during a drop in blood pressure. In some cases, the weakness changes throughout the day. One moment the face looks almost normal, an hour later it clearly droops. This variability should raise concern for infection, but it is often missed. There is also a subtle behavioral clue. Stroke-related facial droop often appears without warning. Someone is talking normally, then suddenly cannot smile evenly. Infection-related facial weakness is frequently accompanied by other changes that people dismiss. Fatigue that seems extreme, chills that come and go, breathing that looks faster or more shallow, skin that feels unusually warm or, in some seniors, oddly cool. Speech problems are where the confusion becomes truly dangerous. Sudden slurred speech or inability to form words is one of the strongest triggers for stroke alerts. And again, that response is correct. But infection can disturb speech in ways that mimic stroke so closely that even trained clinicians struggle. A stroke usually causes a very specific speech pattern. Either words will not come out at all, or they come out wrong, but the pattern is consistent. Infection, on the other hand, often causes speech that deteriorates over time. At first, words are slow, then sentences trail off, then responses stop making sense. The person may seem confused, not just unable to speak. This progression matters. In many septic seniors, speech difficulty is actually the first visible sign of brain involvement. There may be no cough, no pain, no obvious fever, just confusion and broken speech. Families think it is a stroke. Hours pass. Infection worsens. Now let us talk about consciousness, because this symptom changes everything. When an older adult becomes confused, drowsy, or unresponsive, families often assume exhaustion or dehydration. But altered consciousness is one of the most dangerous warning signs of sepsis, and also occurs in severe stroke. The difference again lies in pattern. Stroke usually causes focal problems along with confusion. One arm weaker, one side numb, vision affected on one side. Infection often causes a more global shutdown. Everything slows. Responses are delayed. Movements become symmetrical but weak. The person seems not themselves, rather than clearly paralyzed on one side. Vital signs provide critical clues here. Infection often brings fast breathing, rapid heartbeat, low blood pressure, or abnormal temperature. Stroke more commonly causes high blood pressure as the body tries to push blood into the injured brain. These numbers matter more than most people realize. This is why emergency care must evaluate both conditions at the same time. It is not stroke or sepsis. In seniors, it is often stroke versus sepsis until proven otherwise. Delay in either direction is dangerous. If you remember only one thing from this part, remember this. Paralysis is not the diagnosis. It is a symptom. The cause determines survival. The body after 40 does not behave like the body at 20. Infections become quieter. Brain reactions become louder. That combination creates confusion that steals time. In the next part, we will discuss the most frightening symptom of all: sudden inability to move both legs or the entire body. This symptom terrifies families and misleads professionals, yet understanding how it happens can prevent permanent damage or death. Stay with me. The most important information is still ahead. Now we come to the symptom that frightens families the most and confuses emergency care more than any other: sudden inability to move both legs, or in some cases, the entire body. One moment the person is standing or sitting. The next, they cannot rise, cannot push, cannot feel strength below the waist, sometimes even in the arms. Panic sets in immediately, and for good reason. Most people assume this can only mean one thing: a massive stroke, brain damage, permanent paralysis. And yes, there are strokes that cause this pattern. Brainstem strokes, bilateral brain strokes, or strokes affecting the spinal cord blood supply can shut down movement to large parts of the body all at once. These are medical catastrophes and require immediate action. But here is the reality few people understand. Severe infection can create the exact same picture without a single clot in the brain. In older adults, especially those over 50, the spinal cord is extremely sensitive to drops in blood pressure. When sepsis causes the circulatory system to fail, blood is diverted away from the spinal cord to protect the heart and brain. The result can be sudden weakness or paralysis of both legs, sometimes both arms as well. The person may still be awake, still able to speak briefly, but unable to move. This is not rare. It is under-recognized. There is another layer to this danger. Infections that go untreated for hours or days can damage the nerves and muscles directly. This condition develops quietly, often while someone is sick in bed, and becomes obvious only when they try to stand and cannot. Families think the paralysis happened suddenly, but the damage was building silently. The clues again lie in the details. Stroke-related paralysis is usually abrupt and absolute. 1 second movement exists, the next it does not. Infection-related paralysis may feel sudden, but when questioned carefully, there were warning signs. Increasing fatigue, trouble standing earlier in the day, legs feeling heavy or weak the night before. These details matter. Another critical clue is sensation. Stroke affecting the spinal cord often causes a clear sensory cutoff. The person can point to a level on the body where sensation changes. Infection-related weakness often lacks this sharp boundary. Sensation may feel dull or inconsistent, not cleanly absent. Bladder function is another overlooked signal. Sudden inability to urinate or loss of bladder control can occur in spinal cord stroke, but infection can also disrupt bladder control through inflammation and nerve dysfunction. When combined with fever, low blood pressure, or rapid breathing, infection must be considered immediately. What makes this symptom so deadly is that families freeze. They do not know what to say. They cannot explain what happened clearly. Time slips away. And in both stroke and sepsis, time is not neutral. It is destructive. This is why knowing what to report is as important as calling for help. When paralysis occurs, the most important information is not fear. It is timing. How fast did it happen? Was there weakness earlier? Were there signs of infection, even mild ones? Was there confusion before paralysis? Did the person feel unwell in the hours or days before? Emergency teams depend on this information more than most people realize. It guides parallel treatment. Antibiotics can be started while brain imaging is performed. Fluids can be given while stroke evaluation continues. Lives are saved when both paths are considered instead of choosing only one. The 6 symptoms you have learned in this video are not random. Leg weakness, arm weakness, facial droop, speech problems, altered consciousness, bilateral paralysis. Each one can belong to stroke or sepsis in older adults. The difference is not always visible. It is often hidden in progression, fluctuation, and accompanying signs the public has never been taught to notice. This knowledge is not meant to turn you into a doctor. It is meant to make you an informed witness, someone who can say, "This was sudden," or "This was gradual." "This came with fever," or "This came without warning." That information changes outcomes. If you are over 40, your risk profile is changing. If you are over 50, infections behave differently in your body. If you are over 60, the line between brain disease and body-wide infection becomes thinner than ever. Paralysis does not always start in the brain. Sometimes it starts in the bloodstream. Both stroke and sepsis are emergencies. Both require immediate treatment, but they are treated in opposite ways. Clot-busting drugs save strokes. Antibiotics save sepsis. Delay in either direction causes irreversible damage. If you take nothing else from this video, take this. Never assume, never downplay, never wait, and never believe paralysis has only one cause. Share this with someone over 40. It may be the most important information they hear this year.